Imagine a world where joints never ache and mobility is never a concern. In the heart of Bangalore, one surgeon is making that dream a reality. Meet the orthopedic genius, Dr. Harish Puranik, with over 17 years of experience and multiple fellowships in Germany and UK. He will be telling us all about himself and his practice in Bangalore.
So my name is Dr. Harish Puranik. I am a consultant in orthopedic surgery. I subspecialize in arthroscopic surgeries and surgeries of the knee and shoulder. I finished my post-graduation in 2011, after which I've had a fellowship in joint replacements. I've had a fellowship in surgeries of the upper limb. I've had a fellowship in arthroscopic surgeries. I worked in UK, I've worked in Germany as well. And from 2018, I've moved to Bangalore and I've started working in Bangalore. There are two things that motivated me to get into orthopedics. One was obviously the fact that any surgical branch has a lasting impact. In the sense, surgery cures the problem. Like you have a worn out knee joint, something that happens because of age. We have a solution for it, a solution that is lasting. So the ability to cure people of a problem is very dominant in a surgical field. So that's what motivated me at least to get into a surgical branch. The second biggest motivation is action. Unlike a medical field which is driven by giving medicines and diagnostic treatments, surgical branch is more driven with action. There's a lot of things to do, things to perform, and therefore orthopedics was the kind of branch that motivated me. Within that sphere, I've always loved playing sport. I was a keen cricketer. I was also involved in a lot of other sports throughout my life. So that's what motivated me to know towards ligament surgery, sports medicine, and arthroscopic surgery. So that's how I'm here. So there are a couple of things. When we look at knee replacement, it's basically an elective surgery. So it is something that a patient should experience. It's not an emergency surgery. So having a good ambience in the hospital, having good daylight, a feeling that it's a place where you would want to get something done is very important. And we have got a fantastic ambience here. The whole atmosphere inside the hospital, it's well lit, the ventilation is good, the air is good, the sunlight is good. So it's a place where you want to calm down and want to get it operated. It's a place where you would not feel like you are inside hustle, bustle, emergency kind of thing, hundreds of people running in, hundreds of people running out. So it's a much more calmer place where elective surgeries are done and done at a very calm pace. So it's a place where you would feel much more relaxed and you will not feel like you're inside a hospital. The second thing is the comprehensive team that we have. We have a cath lab, we have a cardiologist as backup, we have an intensivist who covers the ICU as well as the theatre throughout. We have experienced anesthetic staff which can look after your pain management because that's very critical. Immediately after surgery, your pain needs to be managed effectively. We've got a good physiotherapy team as well to ensure that the mobility and the rehabilitation program is done effectively. So the support system that we have built around knee replacement and around orthopedic surgery is quite good. So we've got the expertise to cover any joint replacement as well, whether it is a shoulder replacement, hip replacement, knee replacement, ankle replacement. We've got the expertise to do all of them. Our safety record is very good. The past 3-4 years, we have had as many complicated surgeries as we could get, whether it is 90-year-olds undergoing hip replacement or whether it is young patients undergoing arthroscopic surgeries and things like that. And our safety record is as good as what it should be in the world. So we are very confident that we can manage patients, and we are very sure that we wouldn't say complications don't happen, but we are sure that whatever is the complication, we are ready to face it. We are there along with you to ensure that we can get you out of those complications. So we can assure you that we will be with you throughout second aid.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.